Hey guys, welcome back. Today I want to talk about a topic that I frequently get asked as a board-certified dermatologist by my patients in clinic as well as on my social media, and that is pore size. Are there ways to truly reduce your pore size, and what can you do when you have enlarged pores, and what are some of the products you can use to reduce their appearance as well as help to unclog pores, especially when it comes to treating clogged pores in the setting of acne. My name is Dr. Jenny Liu. I'm a board-certified dermatologist, and welcome to my YouTube channel. I'm passionate about skin, skincare, and all things derm related. So what are pores? Pores are essentially openings on our skin associated with underlying structure, most commonly oil glands and sweat glands. Now we all have pores. Pore size is something that obviously may be of an aesthetic concern that unfortunately is influenced by external and internal factors. Unfortunately, when it comes to defining pore size or enlarged pores, even in the dermatologic literature, medically, there is really no standard definition. A lot of it is really subjective, what you view to be maybe larger relative to somebody else's pore size, or just even on our own skin. Certain parts of our face, especially like around the middle of our cheeks and nose, the pore size tends to be more visible than say on our lateral cheeks, right? So what determines pore size? We know that pore size varies between gender, so men tend to have larger pores than women. Even amongst different ethnicities, pore size can vary. Things that influence our pore size includes increase in sebum production, clogged pores, which often can give off the appearance of a larger pore size, acne, certain products that we use, and even aging of the skin can cause a decrease in the elasticity of our skin that therefore causes the pores to be more enlarged. Pores don't open and shut, they don't shrink. There are certain things that we can do to help improve elasticity of your skin, but contrary to what you may read, washing your face with cold water, steaming your face with hot water does not cause your pores to open and shut. Our pores are in many ways constant in size. Although we can't truly influence the constant size of your pores, there are ways we can help to reduce appearance of their enlargement. So how can we do that? I'm going to break down this video into topical things that you can use at home, as well as for in severe cases, procedures that you can do in office that can help to minimize the appearance of pores. So what are some of the most effective topical products you can use? Well, number one, topical retinoids. Not a surprise, right guys? Topical retinoids we know does a few things. Number one, it helps to unclog pores. When we talk about blackheads and whiteheads, especially in the setting of acne, what's happening is that collection of dead skin with oil and bacteria just sits at the opening and dilates the opening and make the appearance of your pores enlarged. So with topical retinoids, you help to really remove that buildup of dead skin and thereby improving the appearance of pores. Another benefit of topical retinoids is that they do help to build collagen and improve your overall skin elasticity and help with fine lines, and often that we see in aged skin. And so if the pore size is also due to just aging of the skin and loss of skin elasticity, topical retinoids are also going to be helpful in that matter as well. Now, when I mention topical retinoids, I'm mostly referring to over-the-counter adapalene. That is going to be the most effective, or prescription retinoids. Unfortunately, here, you're not going to get significant benefit with the pore unclogging and acne treatment benefits when you're just using over-the-counter retinaldehyde that's more suitable for those who are looking to improve signs of aging. Another product to consider are salicylic acid, beta-hydroxy acids, and even a little bit of glycolic acid or alpha-hydroxy acids can be helpful. Here, again, what we're trying to do is just improve skin turnover, help with exfoliation, help just to remove the dead skin and oil buildup that has contributed to the appearance of enlarged pores. If you were to pick between AHA and BHA, I highly recommend going with BHA, salicylic acid. The reasons are, number one, salicylic acid has better oil gland penetration, helps to more effectively unclog that sebum that is deeper in your pores, helps to improve blackheads and whiteheads, and can be helpful in the setting of treating acne. And for some individuals and certain products, depending on how it's formulated, it can also help a little bit with shine control. I recommend going with leave-on products. They're going to be able to sit on your skin longer to have an effect. One of the cheaper option for acne, clog, pore, etc. is just the one from Clean and Clear. Acne Spot Treatment, Salicylic Acid. And this contains 2% in a gel formulation that is very cheap and effective. And I just recommend using this starting off once a day, apply to the affected areas. For most people, it's like the T-zone, and then make sure you follow with a moisturizer at night or moisturizer and sunscreen in the morning. Another product I really like that contains a blend of 2% salicylic acid as well as AHAs, namely glycolic and lactic acid, is from CERAVE, their acne control gel. This is another gel product that you would apply very similarly to the Clean and Clear product, but it's got a combination of AHA and BHA that will help to work synergistically to help remove some of the superficial buildup of dead skin with the AHAs, and then the 2% salicylic acid is going to go a little bit deeper into your skin to help unclog some of that oil debris. It also has 3 essential ceramides like all of CERAVE's products, and I find this to be slightly more hydrating than the Clean and Clear product. Now, if you have super dry and sensitive skin and can't tolerate gel products containing salicylic acid but want to use a beta hydroxy acid, one I recommend is from CETAPHIL, their Gentle Clear Mattifying Acne Moisturizer. Now, this is a moisturizer that contains 0.05 salicylic acid. With the lower percentages, you're going to get less irritation. It may take you slightly longer to notice the result here, but again, when we're talking about unclogging pores and treating blackheads and whiteheads, it's not a sprint, guys. It's really a marathon, because if you overdo it, that irritation can lead to further inflammation, increasing sebum production, and really work against your goals of improving blackheads and whiteheads and the appearance of your pores. And this is pretty gentle, so you can use it up to twice a day if needed, but I would say if you are really sensitive skin and dry, consider starting off with once a day. And like I said, it has some mattifying benefits, especially for those who have more oily skin. It offers some shine control. Another ingredient that can be helpful is niacinamide, and here I'm talking about the lower percentages, 4 to 5% or less. We don't actually know how niacinamide works in temporarily controlling sebum production. We think maybe it helps with the outflow or what have you, but here going with the lower percentages can be helpful, and it's going to be less irritating. Definitely don't recommend the 10% or 20%. That can, number one, cause more irritation, and two, really studies have not shown that high percentages are more effective aside from the irritation. Moisturizers with niacinamide is one of my favorite ways, but otherwise serums, there are a handful. One of my current favorite serums that contain niacinamide is called Beauty of JOSEON, and this is their glow serum with propolis and 2% niacinamide. So this is a really great concentration here, and it contains some honey extract. This is a little bit more of a sticky serum, and so for those with oily skin or who live in a more humid environment, you may not enjoy this as much. Two other products I really like that contains niacinamide in a moisturizer formulation: the NATURIUM Niacinamide Gel Cream, and this is 5%. This is a lightweight gel cream suitable for those with oily skin. It absorbs quickly, is lightweight, and you're getting a good amount of niacinamide in the appropriate concentration that's going to be helpful with sebum control as well. So that is what I recommend checking out. If you have more combination or slightly dry skin, I recommend checking out the one from ROCHE-POSAY. It's suitable for all skin types depending on the season and what else you're using with it, but this contains niacinamide, glycerin, and it's very hydrating but not sticky or heavy. Okay, lastly, we talked about all these active ingredients, but two things that you absolutely must do that should not be neglected is moisturizer and sunscreen. These are essentials of skincare. As I mentioned earlier, excessive sebum production can be a sign that your skin barrier is not healthy and it's dehydrated. So moisturizers are really going to be key here in helping your skin repair itself, support your skin barrier. Just have to find a moisturizer that you like that works well for your skin. So general rule, if you're oily skin, go with oil-free, maybe gel cream formulation. If you are more dry skin, consider something that is more of a richer cream. When your skin is dehydrated and dry, that inflammation can induce more sebum production. That's going to work against your goals, as I mentioned earlier. And lastly, sunscreen, super important. We've talked about this before, right, guys? One of the risk factors for enlarged pores is sun damage. Sun degrades your collagen and elastin, and that is why when we look at older skin, their pore size are more visible. Sunscreen is by far the most important when we are talking about anti-aging and prevention of fine lines and wrinkles and preventing the breakdown of collagen on our skin. So sunscreen must be worn on a regular basis. The best sunscreen is the one that you like, that you will want to wear on a daily basis. As far as like the type of sunscreen, mineral versus chemical. I think they're all gonna be great. Again, it just has to do with what your skin likes and what you like enough that you can wear on a daily basis. So now let's quickly talk about some of the in-office procedures that can be done to help improve the appearance of your pores. Number one are more medical grade high strength chemical peels. So salicylic acid based peels, for example, that are in the percentages of 30% or even higher, that should be really performed by a trained professional. That can be helpful, especially when done serially over time in controlling with sebum, oily skin, and helping to unclog pores, evening out some of the skin color and skin tone that often can be associated with acne and acne hyperpigmentation. Probably by far one of the most effective treatments in tightening the skin and thereby improving the elasticity and the appearance of your pores are resurfacing procedures. So microneedling as well as Fraxel or laser-based procedures that can help to stimulate collagen and tighten your skin are going to be really helpful too. Keep in mind that with any of these procedures, it's not a one-time thing. It can be expensive. It's truly an investment, but all of these are often done, on a monthly basis over the course of at least 3 to 5 sessions at the very least before a noticeable improvement is seen. So medications a dermatologist can prescribe can be helpful, especially when you are experiencing enlarged pores and acne at the same time. So the two most commonly prescribed medications are number one, oral retinoid, so Accutane. We know that Accutane works by shrinking down oil glands. Most people get really dry and thereby over time can potentially improve your pore size. And then oral medications that can reduce hormones that have a downstream effect on increasing sebum. And here the most common I prescribe would be spironolactone. So again, if these are something that you're interested in, please talk to your dermatologist. Now, a couple other tips. Number one, oil production can increase with over cleansing of your skin. If you have oily skin, over cleansing can actually increase the inflammation and sebum production. So make sure that you are using a cleanser that's appropriate for your skin. Please do not over cleanse your skin. We just need to wash our face twice a day, if not once a day. And so making sure that your cleanser is right for your skin. And lastly, lifestyle and diet habits can also influence hormones that have downstream effect on our skin. High glycemic index foods, fatty foods, and potentially dairy products that are associated with acne. They all influence acne in the sense that it actually stimulates oil glands and produce more sebum. So making sure that you are eating more well-balanced, rich in healthy carbohydrates, healthy fat, and protein, and foods that contains a lot of antioxidants are going to just be healthy overall for your skin. Avoid smoking. We know that smoking causes a lot of oxidative stress and inflammation and accelerates the aging of our skin. Lastly, making sure you're getting adequate sleep and exercise. These are things that are just going to be helpful for our overall body health. And when our body is healthy, our skin is going to be healthier. When we talk about making changes that impact our skin, obviously we start at a skincare level because that has direct impact on our skin. But if you're not taking good care of your body and overall health, it really doesn't matter how much you do to your skincare. The full benefits are not going to come through. So taking care of your body is just as important. All right, I hope you guys found this video to be helpful. Let me know if you have any questions, please comment below. And if you enjoyed watching this video, please give it a thumbs up. And I will see you guys next time. Bye.